Testing.
Good afternoon, everyone. Seeking the blessing of His Holiness Jagat Guru Sri Shivratri Deshi Kendra Mahaswamiji, myself Rekha Arman, Assistant Professor Triple E, welcome you all to the second session of Day 6 Induction Program. Health is the biggest wealth for human being in one's entire lifetime. One can survive without excess money, but cannot survive without good health. Dear students, today's session is on tips to stay healthy, for which we have two eminent speakers, Dr. Archana S. and Dr. Shilpa Avrebi. It's a great opportunity for me to introduce our speaker, Dr. Archana S. Dr. Archana S. has completed her MBBS graduation and her diploma in anesthesia from JSS Medical College, Mysuru. She has completed her DNB in anesthesia in 2012 from National Board of Examination, New Delhi, in Apollo BGS Hospital, Mysuru. Dr. Archana has worked as junior resident in JSS Medical College from 2003 to 2005 and then clinical attachment and observationship in UK. She has also worked in Apollo BGS Hospital as senior resident. She has done clinical trials as co-investigator and has several publications. Madam is the Chief Coordinator for JSS AHER Skill and Simulation Center since 2020. She is a USIM certified simulation educator, ACLS and BLS instructor. Currently, she is working as assistant professor in Department of Anesthesia and Critical Care in JSS Medical College, Mysuru. It is a great pleasure to welcome such an eminent personality as our key speaker. On behalf of JSSU and SJC, we welcome you, ma'am. I'm privileged to introduce our next key speaker, Dr. Shilpa Avrebil. Dr. Shilpa Avrebil has completed her MBBS from Justice Medical College, Mysuru. She has done her PG diploma in geriatric medicine from Ramaya Medical College, Bengaluru. She has also undergone 1-year fellowship training in geriatric medicine in UK. Dr. Shilpa has done PG training in internal medicine from National Board of Examination in Apollo BGS, Mysuru. Madam has been principal investigator for grants and funding agencies such as Prebiotic, Sputnik, Covovax, etc. She has been awarded with Best Teacher Award 2016 by Jesus College of Physiotherapy, Best Paper Award 2017 in State Level Conference, Best Role Model Award 2020 from Wessex Deanery, UK, National Award as a Young Scholar 2022 from Indian Academy of Geriatric. Madam is currently working as Assistant Professor in Department of Geriatric Medicine, JSS Hospital, Mysuru. We are so honored to have such a noted personality as key speaker. On behalf of JSSTU and SJC, we welcome you, ma'am. Now I request the key speakers to take over the session. Thank you.
Comfortably fine at the we cannot change it. Yeah.
Good afternoon. It's very nice. To begin with, first of all, I would, with the holy blessings of His Holiness Jagadguru Shivratri Deshikendra Mahaswamiji, I thank Principal SJC and the organizing committee for inviting both of us, myself, Dr. Archana and Dr. Shilpa, for this induction program. Today's topic being, as covered in your induction, staying healthy. What today I'll be talking about emergency, how you have to deal with the emergencies and also the basic life support. And later on, Dr. Shilpa will be addressing about drug awareness and time management. So to begin with, it's totally a different topic from what all you had learned from past 2 days or 3 days of your induction or week-long induction courses. I was going through the schedule of whatever you have learned till now in your induction classes. Could it be, it has a wide varied topics like cyber crime and then patriotism, you had yoga, a previous session. So today we will be dealing a totally different aspect. It is check back to the reality when it strikes. If there is an emergency, what exactly you have to do in a healthcare sector. Like before you go into your hospital, before you reach out for someone nearby, what exactly you have to do is what I need to teach you today. So, can you change the slide? I know most of you are from different places. You could be from Mysore, or you could be from Bangalore, Karnataka, or you could be from various other regions of this country or outside the country when you are joined this course. First and foremost, what I would suggest you all is pre-planning. Pre-planning, you need not become planned, you need not wait for emergencies to happen. So you should be of clear mind what is happening, and for that what you have to do is, first and foremost, you familiarize yourself with the emergency action plan of building layout. Wherever you are staying, let it be your college, let it be your department, let it be in a future when you're working in your office. So familiarize with the building where you're working, and you should know the emergency plans. Leave around the building whenever you know. When you go to a mall, everywhere nowadays it's compulsory. They should have a fire exit, they should have an emergency exit. So you should be familiarized with that building plan. That is mainly because your action thoughts will be clear when you face any emergency. So you're there in a beautiful campus, know about your campus, where exactly what is there, and then get familiarized. It may take some time, so you have to get familiarized, and you have come out of your place, not your hometown. Get familiarized with the systems over there here, how it runs. Okay, so get familiarized with where you have to approach when you have a problem. Especially I'm talking about a problem with the healthcare. Okay, so where to approach, whom to approach, you should be knowing, at least to a certain extent. And so Mysore is very safe place. You don't have weather hazards, but if at all next when you are posted somewhere where there are severe changes or weather changes, you should be alert enough to know the weather changes that can happen in your region, and you should take a proper precautions accordingly. Next slide. This is all why I was talking about familiarize yourself is to call for helpline. Whenever you need help, you are going to call the respective number for the helpline, which I am going to talk later on. So whenever you call for that helpline, you have to tell exact location where you are there. If somebody wants to help you also, if they don't know, if you cannot tell them clearly where you are and what you want exactly, they won't be able to help you. So that is very important, and that gets lost when you are really in emergency. When you are in crisis, there will be that thought block will be there. So that is why, if you know your surroundings well, if you know that what we call when we teach our many crisis emergency courses, I keep telling everyone, it is called as a situational awareness. So you should be aware of what is happening around you. So be situationally aware, and when you call for help, you call and inform the person what you exactly want and where you are and what is needed. Okay, so next slide. In case of medical emergencies, not all emergencies require help, isn't it? So there are many things which I am going to talk later on in slides, will be done, can be taken care by yourself. You require medical emergency help only when you cannot manage the things. So you should know when to call an emergency. Just because somebody has fallen from the bike, you need not take up a phone and call ambulance that I need an ambulance. So you have to assess the situation and then call for help. So whenever calling for numbers, you should know what are the local numbers that has been activated. So we have 108, we have 112, that is probably the national number, emergency number. When you have something, when you are stuck in something emergency, you can call up 112, dial 112 for any emergencies. So your help is going to arrive within few minutes whenever it is required. And for that, when you call, you be specific. What could be the cause? You have an accident victim, or you have someone who is unconscious, you have someone who who has a chest pain. Why this is important is the ambulance is different for everything. So you may not be knowing, but a trauma ambulance is different, cardiac ambulance is different, the facilities will be different inside the ambulance. So you have to give them a clue that for exactly for what reason you require that ambulance or the help. So that is why you have to give them in detail where you are located and what you want. And if you are there in Mysore, we have a sister concerned hospital, JSS hospital, that is the ambulance number. Go to the nearest hospital whenever it is possible. That is what we advise. So or where the facilities or triage facilities are available. Next slide. So this is what we teach most of the students before we start our emergency, how to cope up, how to manage emergencies and all this class. What is that? The scene is safe. We make our students, whenever it's all basically in this induction program, I am giving lecture. But this is all what we, for our students, and when we teach paramedical, ambulance, it's all hands-on practice in our hospital. So you won't sit and listen to any lectures like this. You do hands-on BLS, hands-on ACLS on the mannequins what we have in our simulation center. So what is the first thing we teach our students is check for the scene safety. Scene is safe. What do you mean by scene is safe? You can handle yourself. Okay. Why do you think that the scene should be safe?
There should be no immediate threat like car moving.
To whom?
To both of them.
Yes, it is both for yourself as well as the victim. Imagine there is a road traffic accident. It's a busy road in front of your college. There is an RTA. You know, you have learned first aid. You want to resuscitate. You want to go in the middle of the road and you will start helping around. How do you ensure that the scene becomes safe there? Stop the victim. You can get the victim to the side and then you can start. So you can ask someone to, till then you can ask someone to stop the vehicle so that that vehicle will not come and hit you. So there is another common example. What is there? We saw that drowning. This is what we say, tell most of the students. Many a times students go to beaches to swim. So one of them will drown, maybe for any reason. So what will happen? The other friend will also, in that panicky thing, they'll jump. They will not think whether they know swimming or they don't know swimming. It does not matter to them. They jump around and finally what we get to read the news is all three friends drowned in the beach or lake, wherever it is. So before jumping into that drown to save your friend or the victim, analyze whether it is safe for you. Okay, whether it is safe for you, because if both of you drown or both of the friends drown, nobody will be there to call for emergency and to call for seek for the help. So make sure that the scene is safe before you start resuscitating. Clear? The next slide please. So next is, we'll cover up most of the things where you, before you call up the ambulance, what you have to do. That is the first slides. Later on we'll talk about basic life support. So first is fire. If there is emergency fire in any of the building, what is the local protocol you should know? What all generally you do? Fire extinguisher you should use only, you are expert in that. Okay. So what is the first thing you have to do? Keep calm, evacuate, know the exit plans where you have to do exit. Take the stairs whenever possible. Don't use elevator or lifts. Clear? So that is the fire protocol. And next slide please. Before, if we'll talk about something what you have to keep for the first aid, if for the minor things whenever there is happening. So the first aid kit is something where probably you have it in a vehicle, you can keep it in your house, you can keep it in your hostel rooms, it will be there available. I'm sure it will be there available in college offices also. It has various gadgets like band-aids, gauze piece, scissors, iPads, antibiotic ointment, then face shields and disposable thermometers and first aid instruction booklets. So keep this first aid kit handy whenever, especially when you are going out with your friends, in your vehicle and in your room also if required, especially when you are living in hostel away from your parents. So it can be of some help when small things happen to you or to your friends. You need not call up or go to run to the hospital all the time. All of you must be post-COVID era. Everybody will be knowing what is PPE means. You need not wear the PPE kit where how exactly was shown in the TVs or where you could see the doctors wearing full from head to toe PPE kit. That is not required for all the cases. Next slide. So, but if you feel that you require, you are handling someone who is having a lot of secretions, vomiting, there's a lot of blood. To be on a safer side, always use glove to protect yourself from hazards, biochemical hazards. Okay, any body fluids or blood if you are handling, wear the gloves. These gloves will be readily available in your first aid kit when you have. Next please. So in any emergency, this thing we teach 3 points. So first is assess the situation. The next is alert, and next is to attend. This is the main thing you have to remember for anything, for all emergency situations. So what are you going to assess? Assess the situation. First, as I told, is it safe? Safe for the victim, safe for you. Whether the victim is responsive or not. What do you mean by responsive? Conscious or not. If the victim is not conscious, I'm going to teach you in the later part. If you are not conscious, you have to start your cardiopulmonary resuscitation, or what is called as a CPR. First few parts of the slides we are talking about the conscious victim. Your victim, the victim whom you are going to attend is conscious. They are not unconscious. Okay, conscious, maybe alert or slightly drowsy. So that you have to assess first during your initial assessment. Then always call for emergency help if at all need. Once you assess, you will come to know whether this is a minor thing which you can handle or whether you require some expert's help. Decide on that and call for ambulance, and then immediately attend the victim. Next. So let's deal with small problems what people can face. So these may be the few things which you would have learned in your high school days, or NSS, or Scouts and Guides, or wherever. If you have done any first aid courses, you would have attended for all this thing. How many of you have attended these first aid courses? NSS, NCC camps, Scouts and Guides. Okay, at least in the schools, the BLS and then first aid things. No? I'm surprised, because most of the schools we do cover BLS, and all these first aid classes are taught in schools for at least a part of the curriculum. They have all these things. No? Then fine, you listen here. Then with detail, with concentration you can listen. Okay? So when you have small basic cuts, minor wounds, what you can do is, what could be the signs and symptoms? It could be just bleeding. It could be there will be a skin abrasion, or what we call as a minor cuts. Then for that, like if left, it can become septic or it can cause an infection. So what you have to do is, in case of bleeding, apply direct pressure with a clean pad. What you will have it in a first aid. You have scissors, pads, everything kept. No, you can use that as a this thing. Don't go in by, there are many other methods. I don't think so people use it now, at least in city areas. They put turmeric, they put coffee powder, they put oil. Please don't apply anything. Clean the wound and then put an absorbent cloth if it is bleeding heavily. So put direct pressure on the wound so that the bleeding is going to stop. If you have a severe bleeding, if the victim is having severe bleeding, put cloth tightly, don't remove the cloth. You keep on placing the pads or the bandage cloth one above the other with severe pressure. Meanwhile, what you would have called? You would have called a helpline, isn't it? So when it is severe, you cannot manage on your own. If the victim is bleeding too much, that can lead to shock, that can lead to hazard. So if it is a minor, you manage. If it is a major bleeding, then till ambulance comes, till some help comes, you do this pressure bandaging on the wound. Next. When it could be a crush injury, the same continues. Like you have to apply ice. If it is a minor crush injury, put some ice packs. When it is a major thing, when it is a bleeding inside, when you see fractures, you put a pressure bandage and call for helpline. Next. So what is shock? Only electric shock. I'm so shocked to hear this. You use it word so commonly, no? What do you mean by shock?
Traumatic stress.
Huh?
Traumatic stress.
What?
Traumatic stress.
Traumatic stress. Okay, can you explain what do you mean by traumatic stress?
Somebody is out of either be it mental or physical trauma.
Yeah, that could be traumatic. Okay, I'm so shocked. That in medical terminology, shock is something when the blood flow to your vital organs stop. When it is, as you said, they see something shock thing or trauma, mental trauma stress, the brain would have lost the blood supply, or something else, bleeding happens, a heart, brain, vital organs, if they lose blood, it is called as a shock, wherein the blood pressure drops and the victim collapses. Okay, that is called as a shock. Okay, so next time before you use the word "I'm so shocked," think about this, what is shock. So why you want, when there is a small bleeding and all, you want that shock, prevent that shock. If you leave that bleeding to happen for a long time, person may become victim of a shock. So what are the signs of shock then? How do you recognize this victim is in a shock? There may not be injury or extra, as you said, there may not be many a times external injury. We call it in medical term as vasovagal shock. There may not be any external injury. So what could be the signs of shock? How do you feel? Dizziness, yeah, somebody is feeling very dizzy, and then somebody is feeling very pale, very tired, not able to stand. All those things could be there could be a profound sweating, cool extremities, and then unable to comprehend. They don't know what is happening around to them. So you have to recognize that the victim is in shock and recognize for what reason he is on a shock and what is the treatment. First aid you can do. Help the person lie on their back. So immediately, many a times we see our students, ours is a very hectic course. They come to class by morning 8 o'clock, they finish hospital work, they finish the rounds, many a times they don't have breakfast, morning 8 o'clock, they come to the class at 10 o'clock and many of them will fall. Ma'am, suddenly they'll fall. So what is that? It could be a shock, isn't it? We call it as vasovagal shock. So that dizziness. So keep the victim lying flat. So what is the first thing you have to do? You make them lie on the flat surface and then cover. If it is very warm or if it is very hot, you have to make the surrounding temperature cool. If it is very cold also, the extreme weathers is also, both are bad. So ensure an open airway for victim to have an adequate breathing. So beyond this, if the victim is unresponsive, then what you have to do? You have to start the cardiopulmonary resuscitation or CPR. Next. So as I told already, if there is a severe bleeding, don't try to manage the bleeding on your own. Till some help comes, put pressure bandage, everything, and then ensure that you shift the victim to a higher center. Next slide. So first aid for burns and scalds. So what could be where a victim can have a burns and smaller minor burns. I think all of you could have, one or the other time would have had this small burns or scalds at home. What it could be? Next. So it could be thermal burns, it could be chemical burns, it could be electrical burns. So burns on the face, hands, feet could be particularly serious. You have to take a special note on that. Okay. Next slide, ma'am. So whenever there is a burn, so you have to assess it. If it is a burns, severe burns, 80%, 90%, the victim is in a fire from the building, all those things. Can you manage on your own? No, you have to call for emergency helpline and then shift the victim to the nearest hospital. When it is a small burns, you can treat thus, and then always, what is the first priority before you rescue a victim? As I already told you, personal safety is your first priority, should be. Just because somebody is there, some fire, you cannot endanger yourself also. If a victim is on the fire, tell him her to stop, drop and roll. Okay. And if the victim is in contact with electricity, do not touch them until the source of electricity has been shut off. This is in case of a electrical burns. I think all of you know about it, right? Next slide. So if it is a minor burns, there may be pain, redness, swelling, blisters. What you have to do is Don't put any pressure bandage on that. Expose the burn, cool the burns with the cold water and continue until the pain lessens. Only put the cool water, not very ice cold also. And do not pop off the blisters and do not apply any antibiotic ointments unless it is suggested by a healthcare professional, because you get many of the over-the-counter ointments which are not good, so you should not apply on the burns. So bites and stings. Anybody has that experience of bites and stings from insects? Yes. What bite? Bee stung you. Okay. What did you do? Huh? Calamine lotion. Okay. What? You had any itching or anything like that? Okay. Yes. Somebody else? Raise their hands. Yes.
I had a honeybee sting and then Kamblihuda sting and
A Kamblihuda sting.
and even a spider sting.
Even a spider. Okay. So when do you think that you have to seek help of a doctor?
When your hands start getting numb after
Numb. If there is a honeybee 1 or 2 or even the wasp 1 or 2 stung, 1 or 2 bites you, it may not be very dangerous until you have a few people, even for one honeybee they can have an allergic anaphylactic reaction. There may be a redness, swelling, they'll feel dizzy, as I told you in that shock, no? Then immediately go to a healthcare professional. Otherwise many a times in your campus also it may one ant, spider, wasp. If this, you need not take, what you have to do is a first aid, but you should know that when it is in a huge number, swarm of bees or like that stung, there are chances that they may have some allergic reactions. So always you seek a medical expert. So this I am talking about a small insect bites like wasp and spider. Here in India you don't have so many poisonous this thing, but abroad in schools also when kids are there in first standard, second standard, they teach children how to identify a poisonous spider, because there it is very common. Spider, if it stings, when to call up for help, that is all being taught at a school level. Okay, and then next is it's not comes under the insect, but it could be if it is any bite from a poisonous snakes, venomous snake, identify when you need a help, and then definitely if it is a snake and if you think that is a venomous snake, you have to call for help and take the victim to the nearest hospital. Okay, so they're all shown like cut open the wound, take out the venom, suck the venom, tie the tourniquet is all outdated and it's all shown in the movies. You should not do all those things. Whenever possible, keep the wound lower than the heart level so that the blood venom will not reach to the heart very fast. So take the victim to the nearest center where they can administer the antivenomous drugs. The next. So small bites, and this thing what you can do is wash the area with soap and clean water, cover the area with adhesive bandage, apply ice, and few of the like scorpion sting and all you can wash with the soda bicarb water if you have near availability. Next. So eye injuries. What all can cause eye injuries apart from your continuous laptop watching? So it could be a foreign bodies, a dust, you're moving in a vehicle, you're working in a laboratory, something spills into your eyes, you're working or moving around, something foreign body objects. The first and foremost thing is don't rub your eyes. Eyes are very delicate, as even a small scratch on your cornea can have a vision problem later on. So don't rub your eyes and wear a protective eyewear whenever possible. So if you know that you're working with the hazardous chemicals, if you're doing some work in the lab where there is a lot of dust or chemical is going to spill, take a preventive measure first only. Wear a spectacles or a goggles, that is a protective one. Next one. So the rinse eye with saline solution or tap water. Do not try to remove the object on your own. Even if you can see something, some metal object or some glass piece on the inside the eye, don't try to remove it on your own. Do not allow the victim to rub the eyes, that is the first most thing, and cover the eye lightly with a gauze pad and then seek the medical attention. Next slide please. A nose bleed, which is quite common because of many things. It could be because of the habits. Some people have this nose picking habit, so that repeatedly can, if they have that repeated habit, that can lead to nosebleed. So many a times it's not very dangerous, but if you have repeated nosebleeds, seek a expert opinion why it is happening. When there is a nosebleed, what you have to do is you have to pinch the nose and bend forward and sit. Why so? That will allow you not to swallow the blood, and that is also, bleeding also will reduce with that. Next. So sit upright and lean forward, pinch the nose firmly, and to prevent the rebleeding, don't pick or blow the nose whenever that happens. Next. Though this is diabetic emergencies, why I thought I'll cover up here is, nowadays we get to hear a lot of diabetes among youngsters. One other most thing what I want to suggest is, please inform your mentors, friends, teachers, whatever medical problem you have. There is nothing to hide if you have any medical problems, because when your close friend does not know what problem you have, even if you have some emergency, he won't be able to attend. This applies to all colleagues, elders, students, anyone. So tell someone that you are having this problem, and then if something happens, they will be able to attend to. Because recently we had a case in emergency, he is one of our colleague doctors, but none of us knew that he was diabetic, and he went for a marathon, and he was just totally tired and almost collapsed in ER. So but none of us knew he was diabetic. So make sure that you have at least some person around you know if you have any medical problems. So diabetic is one of such common problem. It could be your parents at home, it could be your friends, it could be your teachers. If anybody is having low sugar, they can have here there are two variants. One is sugar becomes high, sugar becomes low, which is more emergency is sugar becoming low. They will become dizzy, they will become very altered sensorium, and in the severe cases they can have convulsions. In such cases, it becomes very handy if somebody knows that they are having hypoglycemia or low sugar level. They didn't have their breakfast, they didn't eat well, they have taken their drugs, diabetic medications, so can give them a sugar tablet or whatever, sugar, jelly, honey, nearby, whatever the chocolate that is available, and that is going to remedy the problem. Next one, heat exhaustion and heat stroke. In this extreme temperature, when you're working out especially, it can lead to a lot of dehydration. So hydrate yourself well, and whenever you feel that it is beyond the control, if even with drinking the water, if the body temperature is rising, what is the first aid treatment? What you can do in such cases is take the victim to the nearby cool place, drink cool water, and then also if the body temperature does not come down, take them to the nearest hospital. Next comes the part of the thing where all these things were the minor injuries what I told. Next part of the thing is where it could lead to a cardiac arrest. What is cardiac arrest? Heart stops completely. So when it can stop, it can be due to many of the reasons, like initially we used to tell, okay, underlying heart disease, we had this victim, that patient was hypertensive, diabetes, elderly, but nowadays the scenario is changed. Now you all know that young victims, especially working out in gym, healthy, singers, actors, you all know, no? So many of them had the cardiac arrest. So what is important is the initial few seconds of it, okay? How somebody recognizes. We have the story of like how a person, I had the video, sorry I couldn't put it in the PPT. There was a person who was working out in the gym and suddenly he collapses. Then the person around there were all trained in doing BLS, and they started resuscitating him, and then the emergency ambulance came and then took him to the hospital, and he was survived. So and then he has given an interview like that, you know, like that becomes very important, wherein you recognize someone collapses and then you start your BLS, you can save many lives. Next, so this is, sorry ma'am. So this is one of the condition where you can have a pre-arrest, what is called as a choking. What do you mean by choking? Something gets stuck in the throat. What can get stuck in the throat? Like, generally, normally when you eat something, you don't choke, isn't it? Toffees, yes, but many a times it may not be so severe that you can stop breathing. Vegetable fiber. One who does not like vegetable can give the answer. Fish bone, a chicken bone. We have had many fish bone cases where the choking can happen. So where you can expect this to happen? Huh? Where? Yes, restaurants or any eatery. So you are seeing a person at table sitting next to the table to you, suddenly starts coughing out and he is unable to breathe. So what could you think of? Yes, Heimlich maneuver, very good. That is a choking. That is choking. The maneuver what you do is called as a Heimlich maneuver. Who told that answer? Okay, what do you do exactly? Tell me. In Heimlich maneuver.
You go behind that person.
Yes.
Wrap your arms
Very good.
near his diaphragm.
Yes.
Pull it towards you.
Pull it, push it backward so that the foreign body, whatever it is there, it comes out. So this is a life-saving procedure. So you can save a victim. So if you leave unattended to such victims, what can happen? They can have a cardiac arrest later on. Like immediately they can not able to breathe. Later their heart is going to stop. So quickly ask, are you choking? If they nod or if they are not able to answer, imagine they are choking. So next what you have to do is, this is called as a Heimlich maneuver. As I told, you stand behind the victim and then you put your hands below, just below the ribs, above the umbilicus, midway, and then make a fist and then give few thrust. Forcefully you have to give thrust. What will happen? So that foreign body, whatever it is there, it may come out. Okay, if the victim is obese or pregnant, you cannot give it on the abdomen, you can give it on the chest also. Okay, if the victim is very obese, you cannot give it on the abdomen, then you can wrap around the chest and give, but abdominal thrusts are more effective, so the foreign body comes out. So this is one of the life-saving procedure you should know. If you leave unattended, so the victim can become unresponsive. So what will you do if somebody becomes unresponsive? What is CPR? Very good. Cardiopulmonary resuscitation. We heard during especially our celebrities' death. How many of you are from Karnataka? You all knew Puneet Rajkumar? Yes. So at that point of time, even in TV, there was a lot of discussion about the CPR. But I could see one of the channel was highlighting that CRP was not given. CRP was not given. Such is an amount of knowledge. It's our fault that we have not trained, like, you know, like the public are not so aware about it. So, but of late many people are getting, we are training all our public personnel, you know, like police officers. It's mandatory training for them. Before also they were training, but nowadays people are getting more self-conscious, like how they are becoming health conscious of their own. They are becoming conscious about this CPR also, because we are having lot of cardiac arrest among youngsters, especially working out in the gym, and then on dials, on this thing we are hearing, no? So what can lead to a chain of events is early, next month. So if any unresponsive, start with your next slide, ma'am. So in any emergency, what will you do first? Recall. First assess the situation, assess the victim, call for help, and then attend. Next slide, please. So we have something called as a chain of survival. This is what is very, very important. You know, first you recognize what happened in our celebrity's case. So whether it was recognized, if it was recognized, whether the immediate help was taken. There was a case wherein there was a singer he had chest pain, he had sweating on the dais, and then he was taken to a hotel room. So where he collapsed and he died. So where he should have been taken into, rather to a hospital, isn't it? So first what becomes important is you recognize and you take them to the help, because in the chain of survival what you see is first is recognize, then start your early CPR. So what is CPR is cardiopulmonary resuscitation. I'll next teach you how exactly to do CPR. And then there is something called as a defibrillation, or giving a shock to the victim, defibrillate using emissions. And then you shift to the, by the time emergency ambulance comes, wherever you are, ambulance takes at least 5 to 10 minutes to come. Before that comes, if you start all these basic procedures, the chances of survival will be very high, rather than like you skip all this and shift the victim to highest cardiac center. The chances of recovery for that or survival of that victim is very, very less. So what is most important is immediate recognition of the cardiac arrest and activation of the emergency system. Next, high quality CPR and rapid defibrillation, then shift them to ambulance. Next. So, as I told before, cardiac arrest, is it always secondary to heart attack? No. It may happen due to accident also. Accident, somebody has lost lot of blood, cardiac arrest. So, final end result is a cardiac arrest where heart has stopped working. So, assess whether the scene is safe. Whether it could be a fire, drowning, road traffic accident. Make sure that the scene is safe for both the victim as well as you. Inside the gym also, wherever somebody has fallen, make the scene safe. Next slide. So next would be tap and shout for the response. So you have to recognize, cardiac arrest. Somebody is having cardiac arrest. So how do you recognize that somebody is having cardiac arrest? Before that, check for the response first. If they are responding, you know that they don't have cardiac arrest, isn't it? If they are, yes.
Now, what is the difference between heart attack and cardiac arrest?
Yes, heart attack is something where when the blood supply to the heart is reduced and patient will have chest pain. End result of the heart attack could be cardiac arrest, but not all heart attack can lead to cardiac arrest. Okay, we have in heart something called as a electrical activity as well as a muscular activity. Heart pumps the blood like this. Cardiac arrest happens when there is an electrical conductivity stopped. We all see ECGs, isn't it? So to know the electrical activity of the heart. So when that is stopped, you have cardiac arrest. One of the causes for the cardiac arrest is massive heart attack. Okay, heart attack is something when there is a blood supply, underlying blood supply or to the heart is reduced. So that can lead to cardiac arrest. But as I told you already, cardiac arrest can be caused by many other reasons also. But the end result is the stoppage of the heart. So cardiac arrest happens when the electrical conductivity is stopped. So in many cases, when there is a heart attack, if the victim is having a chest pain, if the victim is having sweating, you take them to a hospital, the victim survives, isn't it? So they will do a immediate revascular surgery, they will revascularize the heart, they will give some drugs. So cardiac arrest will not happen in that case of heart attack.
So you're saying that heart attack is caused due to the heart functions in two ways. One is the electrical part and the muscular part. And when it is a cardiac arrest, it happens due to the electrical part. And
yes. It goes in like, it's not separate, it's not like the muscular, it is pumping separate and the electrical conductivity is separate. It's simultaneously everything is happening. Okay, but when the electrical activity, that is a concept behind you are giving a shock to the victim. I will coming to that in the next step. So your heart has stopped. There is a mission where you can give a shock and that can restart that rhythm. That is why we are teaching everyone, even in BLS, you know, like to restart a heart. There is a campaign called as a Restart Your Heart, Restart a Heart on the World Heart Day. So we teach them how to use that mission, give shock and to restart whenever possible.
Later or something.
Next I'll be talking about it. What is that? Balloon. Oh, those balloons are getting popped, is it? Next I'll talk that. Later on you can ask your questions.
Does it start the heart or just try?
It will restart the heart. It will restart the heart. I will talk to that. Okay. So first and foremost is recognize. First, no response if he is having cardiac arrest. Next slide. So next step is what? You are alone. Imagine like that in the park. Somebody has fallen like that. So what will you do? You are alone. Shout for help. Nobody is there. Who will come? So before starting next step of CPR, call up ambulance or emergency or any helpline number you know, and then start for the next step of CPR. So many a times what happens is we teach in our classes, even if when there are 100 people surrounding you, you know, none of them will actively voluntarily come for your help. All will be busy recording through their mobiles. So you have to call out for help. The person in the black shirt, can you please come and help me? The person in the yellow shirt, can you please and come help me? This is the way you have to call out for your help during emergency. Otherwise, nobody will come to help you. All will be busy recording, okay, this has all happened during there. So call and shout for help. Next step is. And then if you know how to check for pulse and respiration, check it for minimum of 5 seconds. If you don't know how to check, because many a times we tell and people forget also. If you know how to check for pulse and if the victim is breathing, check for pulse minimum of 5 seconds, not more than 5 seconds. Why we don't stress on that is, many a times what they do is, okay, let me check in the neck, let me check in the hand, let me check in the arm. So you should not waste time checking pulse. If you feel that there is no pulse, if the victim is not breathing, start your cardiopulmonary resuscitation. So how do you start? How do you give chest compression? Anyone has idea of CPR? It's written there all. Yes.
First, you wrap your hands like that.
Yes, you place the heel of the hand. Where do you place it? On the lower end of the breastbone of what we call it as a sternum. Okay, lower end of the sternum you are going to place your hand. Yes, next.
Then you go beside her. Ma'am, first you take his hand and straight it so that there is no blockage in his breathing.
First is not airway. First is always, now the importance is on the cardiac. Okay, so first is almost concentrate on the heart. Later part is your airway. Okay, so place the hand on the victim's lower chest of the victim, and then first and foremost your victim will be lying on the floor or a hard surface, okay, lying flat, and you will be sitting either to the right or to the left, whichever side is feasible. You will sit and place your hands, that is a palm on the lower end, like as shown in the figure. Interlock with your hand, the other hand. The next slide you can show on like this, okay, interlock, and you also have to sit comfortably and knees bent, and the pressure should come from the shoulder, not from the elbow. You cannot lie down on the victim and do CPR like this. So this is exactly the way you have to keep the hands on and then start your CPR. So what should be the rate of the chest compression? It is around 100 to 120 per minute, okay, and the depth should be at least for 5 minutes. Then only you will have enough of chest compression that can happen. Okay, so the rate at 120 to 100 to 120 per minute. The next slide. So this is what that is how exactly you give CPR you will be continuing that CPR till when? Till some help comes. That is why, and it is very, trust me, it is very, very difficult. Not if we tell every 2 minutes to alternate with the person, but 2 minutes also it is very difficult to do. That is why you have to call for help as early as possible. This is that automated external defibrillator, or called as AED machine. When it is available, use as early as possible. You would have seen, anyone has seen AEDs here? I have to finish fast because Dr. Shilpa's talk is also there. Where have you seen AEDs? It's all kept in the malls, airports, railway stations, and then you have to, public should be aware of using it. So once you open that and switch it on, it gives instructions on its own, like what you have to do. So you can connect the pads, give the shock, and the heart can restart on its own. Next. So then shift the victim in an ambulance to the nearest center. So this is all, you do it prior you reach the hospital. Then only the chances of survival will be high for that victim. So imagine somebody collapses in the gym, you have to do BLS, if possible give a shock and then shift the victim to the nearest hospital. The chances of survival will be high. The next slide. So with your first aid training and CPR training, definitely you can make a difference. This is like something more like a hands-on practice. If at all you all are interested in learning BLS, come to JSS. We will have a one-day course and you can learn a hands-on BLS training. Okay. With that, I want to end this and pave the way for Dr. Shilpa for next class. Okay. Thank you so much. Any questions? Probably we can address it together in the end. Hi, good afternoon. Can you all just stand up for 1 minute? Hands up. Clap your hands. That's for Dr. Archana. So next time, thank you. So now, I know, though the sessions will be good, sometimes we get, like, you can't sit for long, so I think that was just a warm-up for you. Whether you like it or not, I'll make sure you all listen to me. I think you will probably remember whatever I have told. See, the reason I won't take much of your time, probably next 20 minutes, I'll briefly tell what I have to convey. I think this is a nice time because we come to college and it's quite tempting. You all are new and you're out of, probably away from your parents, and you are exposed to too many things. And this is a very tender age, and I'm sure you'll be feeling Manelo Amma Appa idne heltare, illu idne heltare. But yes, that does make a difference. Just give 20 minutes of your time and you'll have quite a good information, probably more of pictures. Remember those pictures when you think of doing something. Okay. So we all know what drugs are. Of course, all our medicines are drugs because anything which enters our body which causes some physical or chemical or physiological changes. When I say that, it does some changes in our system which affects the mind, body, your heart, or any system in the body which will make a change is called a drug. So drugs in any dose, when it is high dose, it is definitely harmful. Given in a form where it treats your disease, it is medicines. So now I'll speak about drugs, right? Next. So for definition, it's all a chemical and substance that affect both your mind and body. Prolonged use of drugs may lead to physical and psychological dependence. This is something which is very, very dangerous. So psychological dependence for a drug causes lot of issues, and overdose of any drug will lead to death. See, why do we all, I mean, as a teenager or probably when you're exposed to things, you feel like you want to
feel more matured, you want to think like how an elderly thinks, or you want to feel light, you're stressed, or maybe probably your friends or family want you to try something new. And most commonly as a youngster or in your college, you want to get rid of the stress because you have your internals, exams coming up, and you want to be a hero in this college, isn't it? Or like a heroine, you feel good when you have a cigarette in your hand. So that's something, because all your heroes or your stardoms are all with a cigarette. So I think that's one of the reason you want to try it, but no, don't do that. So as I said, these are all the risk factors. I don't want to go through that. You all know what are the risk factors, especially when you have your friends who is trying. So that is the biggest risk factor is your person next to you. So I would suggest, don't sit next to a person who is an addict or who wants to try smoking or drinking. That doesn't mean don't make him an isolation person. It should be the other way around. You influence him than him influencing you. Okay. Just for your information, we all feel drugs make you feel good. There are different types of drugs. The reason I'm telling you is, don't think I'm giving you an overview of the drugs and go, don't try that. See, there are some drugs which stimulate your brain. For example, now we're sitting for a long time, you want to pay attention, you like to have a cup of coffee. That is a stimulant, because caffeine is a stimulant. Coffee, tea is all a stimulant. And there are some diet pills which will make you more alert. And even nicotine is a stimulant. Nicotine is a substance which is in cigarette. So these things which stimulate your central nervous system, example your caffeine, nicotine, and there are some drugs which are called amphetamines, especially your drugs which are appetizer or appetite suppressants, or which will increase your appetite. Again, these are all stimulants. And alcohol especially are depressants. When you take the first ml or a peg of alcohol, you might feel good. The next, you will knock off. So that is a depressant. That will make you more drowsy. And then you have hallucinogens. These are the ones which are quite common in youngsters, because you are sitting here but still you can feel you are somewhere else. See, when we speak about this, it makes you feel like, yeah, let me try that. When you know what actually it does to your system, you will not do that. The main reason, the hallucinogen, especially you take a substance, it gives you vivid dreams. You know, especially if you guys have undergone some surgeries, you get anesthesia. So some anesthetic drugs will make you feel like you had a very good dream, you went somewhere, you met someone. So you go in search of that someone and you will never come back. So don't go in search of that, okay? So that's what hallucinogen does. So that doesn't exist. So you are in your probably lot of fiction movies, so you will be in that fiction. So that world does not exist. So don't go by the word, let me try that. So it will try and it will just take you, okay? Yeah, alcohol is something very easily available, especially in Karnataka. Yes, we all rock with alcohol. You go anywhere, anytime, alcohol ki jai. So I think especially you guys have this thing easily available. Remember, in low doses it gives you a very good relaxing effect. I'm sure you all have seen your friends or your seniors or your family friends. Yes, in low dose effect it makes you feel your tension is reduced because you're feeling drowsy. You all sleep now, you'll feel it will be relaxing as well. And mainly the inhibition what you have is impaired. So that's why I think it's quite common. You have a peg, you are allowed to speak all nonsense, though you know what you're speaking. So you can always say that I had a peg, so I just spoke it. Because it impairs it decreases your inhibition, so you start talking more. And impaired reaction time, yeah, what happens? So suppose I ask you some question when you are taken a small amount of alcohol. The time taken to answer that question is more. So the reaction time is also impaired. But in medium dose, your speech starts getting slurred. So you have slurred speech and altered emotion, you may start crying. So basically you go to a party, all of you are there, you're going to a party to celebrate your first internals marks, you all are in first year engineering, you got your first internals marks, you all pass, so you go, your friend wanted you to try, you tried the first effect, you all feel good, you're relaxed and you start speaking about who is good, who is bad, what made you nice, and then you all start your speech is that those things has to be recorded. You will start having slurred speech and then you will all sleep off. So you drink more and more, you will not come back. Okay, don't do that. Just see that picture. A, which is a normal elderly person. I'm a physician, but I work with the elderly persons, okay? So an elderly person's normal brain is what you see in the first picture, fine? And then you know Alzheimer's disease is a patient or a person who has memory disturbance. They don't have good memory, they are lost, all those things. I'm sure you must be knowing about that. Okay, the last one is a person who drinks alcohol. So would you want to have that brain inside your skull? Yes or no? I can't hear no. It looks like you all want to try. Are you all sleepy? So you want to try alcohol and have that brain? At least remember that picture. We'll see. No ma'am. Probably again final year we should come and give one more lecture. Yeah. So again, liver, we all know alcohol, the major effect of alcohol is to the liver. That is a normal liver which has a nice color. The other one is a fatty liver. Your liver becomes big. And remember, I don't want to go to the medical background of liver. If your liver is damaged, all your movies, Devdas, whatever movies, they start, yes, it is correct. Sometimes movies show something which is good, which has a good impact. You will have blood vomiting, you can even pass blood in your motion, and that's a mess. It's a disaster. So my recommendation, if you ever get tempted to try smoking or alcohol, please visit us in a hospital. Come in a batch of 5. I'll take you to the emergency area and to the ward where we have patients who have been drinking chronically, smoking for a long time. Once you see them, I'm 100% sure we'll save 40 minutes here. I think 10 minutes of hospital visit, speaking to those patients, you will never touch it. For sure. So tobacco, remember when you have cigarette in your hand, it has lot of things next. So it has candle wax in it, it has paint, it has sewage gas. So you want to try it, you can still try it. So cigarette is made up of all the things which has to be in the garbage. You still want to put it in your system and try, you will be in garbage. So medical consequences, as I said, there are around 7,000 chemicals. Don't think that it is only nicotine. I will smoke which has nicotine-free cigarette. No, there are few advertisements and manufacturers who are coming up with nicotine-free cigarettes. It has lot of other things which can cause cancer. Okay. So this is all for your picture. This is what happens if you smoke. I think all movies, Kantara, all Tara movies it will show, but it should be registered in your brain. Okay? Yeah, next. See, these are the celebrities who have lost their life because of the drugs. Next. Of course, when you are under the influence of drugs, your reaction time is impaired, your decision-making capacity is impaired. When your decision-making capacity is impaired, you will definitely commit a crime. Don't think that you are a student, but you're all will be 18 or going to be 18 or you're above 18. So crime is a crime. Don't get into such scenarios where you are committing a crime where you are under the influence of drug. That's going to cost you a lot. Okay, next. So it's just not worth the risk. Time management, anyway, there's no time, so I think I shouldn't go for that. To manage your time well, don't say you don't have time. You can always prioritize. You should know what you have to do first and learn to say no when you cannot do something, not for your teachers, for your friends. Probably especially the next 4 years, you must prioritize your studies. To study, it doesn't mean that you shouldn't have friends. Have friends, have healthy environment. Mental health is a must. I'm sure they have a lot of topics on mental health. And my recommendation is have good friends. Always be positive. All is well, you know, all is well. So keep speaking positive things that will definitely have an impact. Don't go behind drugs thinking that will make me feel good. There are a lot of other ways to keep yourself happy, healthy and calm. So manage your time well by saying no to wrong things. Okay? Thank you.
Thank you, ma'am. I would like to thank our key speaker, Dr. Archana and Dr. Shilpa, for sharing their valuable suggestion to stay healthy. Hope our students are going to inculcate, give tips given by them to stay healthy. Thank you, students. Thank you, ma'am. Students are hereby requested to stay here. And this session will start at 1:30.